wanna see you when you came home, 'cause you always try to hurt me and that's so low. When I talk to you about it, you're in defense mode. Whoa, oh, 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 oh. How can we work on ourselves when you say no? Whoa, oh, oh, oh. I'll never go on like this, so don't you think you got me up? Yeah, I can't seem to deal with this. You try so hard to pull me in. I'll never go on like this, so don't you think you got me up? Yeah, I can't seem to deal with this. You try so hard to pull me in.
She got me hooked up.
Well, she pulling me in like a black hole, trapped in a grip and I can't break. Out of control and I can't feel my soul and my heart on my damn face. 'Cause I ain't be nothing without her. A king with no queen and no damn kingdom, serving up hate with a cold vengeance. Fuck, but I hate her, we can't slay them. Yeah, she's got me hooked, I'm down, I ride. Leaving, she tried to kill me, I can see it in her eyes. Yeah, she's got me shook, this my demise. I'm bleeding, can someone heal me? I can't deal with no more lies.
I'll never go on like this, so don't you think you got me up? Yeah, I can't seem to deal with this. You try so hard to pull me on me. I'll never go on like this, so don't you think you got me hooked? Yeah, I can't seem to deal with this. You try so hard to pull me in. I didn't wanna see you when you came home, 'cause you always try to hurt me and that's so low. When I talk to you about it, you're in defense mode. Whoa, oh, 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 oh. How can we work on ourselves when you say no? Whoa, oh, oh, oh. I'll never go on like this, so don't you think you got me up? Yeah, I can't seem to deal with this. You try so hard to pull me in. I'll never go on like this, so don't you think you got me up? Yeah, I can't seem to deal with this. You try so hard to pull me in.
She got me hooked up.
Well, she pulling me in like a black hole, trapped in a grip and I can't break. Out of control and I can't feel my soul and my heart on my damn face. 'Cause I ain't be nothing without her. A king with no queen and no damn kingdom, serving up hate with a cold vengeance. Fuck, but I hate her, we can't slay them. Yeah, she's got me hooked, I'm down, I ride. Leaving, she tried to kill me, I can see it in her eyes. Yeah, she's got me shook, this my demise. I'm bleeding, can someone heal me? I can't deal with no more lies.
I'll never go on like this, so don't you think you got me up? Yeah, I can't seem to deal with this. You try so hard to pull me on me.
I hope my voice is visible right now. If yes, then please drop in a message. So I need to go back from the scratch all over again. So yeah, starting from the scratch again, I just wanted to tell you guys that I will be doing this live session every day from 3 to 4:35. I want to spend dedicated 3.5, 4 hours doing these sessions on a daily basis. And apart from that, I wanted to tell you that this stream that you're watching right now, you can expect a 15 seconds of delay so that if at all any technical glitches happen, I can fix it. And thanks for letting me know that the voice was not audible, and I hope it is fixed right now. So initial 3 to 3:30 is the time wherein I will be answering a lot of questions. I will be telling or teaching you guys whatever I know, and we will be doing LinkedIn sessions, job huntings, internship huntings, exciting things which will help college students like you who are watching the stream right now to excel in your career. So today what I wanted to do is, we have around 20 minutes left. So I will take you through my LinkedIn profile, how I hunt for job opportunities, how I search for job opportunities, how I network with the right kind of people, and how I am increasing my LinkedIn profile views and pretty much things like that. So I hope it will help many of you who are in your college, who are basically working professionals and things like that. Okay. So this is how my LinkedIn profile currently looks like. I hope it's visible. And to start off with, I'll just tell you how you should make your LinkedIn profile. First of all, you should start off with a good cover. Now, a good cover is basically the background image that you see. So whenever someone is visiting your profile, the cover should showcase or tell about you in a very, in a very like crisp manner. So if at all you see my profile, it says that I'm a biomedical engineer and I'm currently working as a sales and a business development professional, and I'm kind of tech savvy. Now I'll tell you why I have put biomedical engineer, why I have put sales and business development, and why I have put tech savvy. Okay. And my goal is to basically empowering tech professionals to soar higher in their careers and make a positive impact in healthcare. I will also tell you why I have mentioned this specific tagline as well. Okay. To start off with, I will first go to my experience. This is the first thing that you should do in your LinkedIn profile is, now most of you will be college students, so this is what you should be filling right away as soon as you make your LinkedIn profile. So in your education, you should add your college, you should add your 10th standard or 12th standard schooling where you have done. And that's basically what you have when you are in college, and that's basically what you can put when you are in college, right? But talking about myself, I started my career with an internship. My first internship was with Case Western University. Now, this is a core internship which I did, but if you see my experiences, I have mentioned each and everything that I have done over the period of over the period from so long when I have started my career with, right? Hi Piyush, I see your message. I hope you are doing great. So, yeah, stay tuned in this session. You will learn a lot of things. Just wanted to tell that to Piyush. So yeah, I started my career, or I started my internship journey with Corrosion Arogyam Biotech, where I did 2 months of internship. It was in Hyderabad, and then that is the first internship I did in 2019 when I was in second year, first semester. Okay. How I got this internship, because many of you are looking for internships right now. So I will tell you how exactly I found out this company, how exactly I got the interview scheduled, and pretty much things like that. Okay. Then, as you like most of the students, like right now, you will be thinking what I should put in my resume, what I should put on my LinkedIn profile. So I was in your same situation. I didn't have anything to put on my LinkedIn or resume. So what I did, I joined clubs in the college. I was part of Karunya Innovation and Incubation Center. I was a head of finance there. When I joined in, I was associate finance lead, and then I became head of finance. So I have mentioned that in my experience. Then I joined IEEE. So IEEE is a club that most of the colleges have for, bunch of engineering students. So I was a marketing coordinator there, and I added that in my LinkedIn. Then I started working part-time. So 2021 was when we were in home, we were stuck with COVID, and I wanted to make some money. I was mostly sitting idle in my home. So that's when I joined Q-in-1. So Q-in-1 is an English teaching platform where you have to teach young students, school-going students, how to get better in oral communication, right? So I joined there. I worked there for 6 months, was making good money. I was making around 15-16K when I was in third year of college. And that's considered again as an experience. I was doing it part-time, so I have mentioned it as part-time. Then July 2021, I got my core internship in Como5 MedTech Private Limited, which is a Bangalore-based medical robotics firm. And I was a process and manufacturing intern there. So my work was basically to design the patch. So if you guys don't know what patch is, when you go to an operation theater, the patient will have a small window from where the doctor will operate. So that there is a patch which you have to apply to the body. So I was developing that patch for 3 months in Como5 MedTech. Again, how I got this internship, how I got my interview scheduled, how, and by the way, this internships that you see, now the Corojin Arogyam Biotech Private Limited, this internship was completely unpaid. So I had to make sure that I cover my expenses. If I'm going to Hyderabad, I had to stay there for 1 month. So all those expenses were on my side. But after this, Q-in-1 paid me. Como5 MedTech, when I was in third year, I got this internship and they were paying me good amount of stipend on a monthly basis. Got to learn a lot of things from them. Then simultaneously, August 2021, I finished it and immediately I got another apprenticeship at Heal Clinical Education Network, which is, so basically there is a hospital in US which is in Cleveland, Ohio. I'll just show you guys the website. Right, so yeah. So this is where I got this virtual internship. So I did basically this virtual internship there in Cleveland Clinic, and they do it regularly, by the way. I'll just show you the exact internship so that you guys can also do it. So these, I will not be making dedicated videos on this. You join this live session and you will get benefited out of it. So it's called clinical shadowing. So basically what you do, it's an amazing internship. So 2023 internships are already over. And so yeah, they do it every year and you can do it virtually. 75 hours of internship is what you will be doing. They have different courses. So I did 101. So Heal Clinical Education Network 101 is what I did. So if you just open 101 and you want to see what I learned, is basically, okay, see, so there is a clinical shadowing starting in February 2024 and January 2024. They have 2 batches already open. You can do that if you click on the lessons. So basically what they do is the doctors teach and they tell you how they analyze the patient if the patient is coming through an emergency window and things like that. It's called virtual shadowing. So there is an introduction and then there is basically terms and services. Then there is an SOP which is given. So you can download it and go through it. I don't want to waste time right now going through the same. So if you see week one, you will have 1 video lecture followed by 1 quiz. So after every lecture that you see, there will be a quiz. So you have to complete that. So week 2, week 3. So every week you will have a class, and in every week different doctors will tell about different patient experiences that they have in the hospital, that they had in the hospital, right? And you will get a course completion certificate towards the end. Which is completely worthless, I would say, but yeah, the learning is more important. But again, course completion certificate is what you can add in your LinkedIn as certification under certification section and things like that. Once you do this, you can also get some passes or things like that if you want. So Heal Clinical Education is the platform. I will just share the link to you guys over the chat. So that's the internship opportunity I was talking about. So that's about the apprenticeship which I did. And then again I did another internship in Case Western Reserve University. They also have virtual internships for biomedical students. If you just go to Google and search it, you can go to the internship section. And yeah, they have virtual internships every year. uh, yeah, so this is what I did. It's called remote externship. So externship is basically you are in a different country and you want to do an internship. You can do that. I think this is through a third party platform, but let's just explore since we are here right now. Apply for an externship. So you can apply now. You can eventually work with Fortune 100 companies. There are testimonials from students who have been doing this internship. So go through the website and apply for it if you want to. It's called Paragon 1. So there are product discovery internship, business development internship, AI powered customer discovery, remote internship, gaming, content creation, and marketplace. So I don't see healthcare so far in this domain. Okay. Anyways, so we just now explored a platform where we can apply for internship. I will share that across in the chat so that you guys can check it out later. Coming back to Case Western University, I did an internship and I'm sure every year they have this internship opportunities coming through. So finding an internship, log into my career, visit lab. Okay, let's just put virtual internship. So these are campus-based internship, non-campus-based internship. So also, just to give you guys a heads up, if at all you want to do an internship in their university in the US, these are the opportunities that you have. You can apply. If you are getting shortlisted, you can go to their campus and do the internship. And heart, lung, and blood minority research training program. So every month they have some program or the other. Attend these programs, because when you do these programs, that's when your resume stands out. That's when your profile and your resume will be different from the students in your classroom, maybe. So coming back, non-campus based summer internship, not management, STEM, science, technology is the one we will fall under. So yeah, this is the one which I did, which is an internship from Cleveland Hospital. They have a collaboration with Cleveland, Ohio Hospital. And so yeah, unfortunately the internship opportunity is not there, but it eventually comes in the month of June. So May you will see the opportunities coming in, and you apply. It's completely free, and it's in the night shift. So like even if you have colleges, even if you have college going on, you can come back to your hostel, and this internship starts at around 10 in the night, 10:30 in the night, and it goes around, I think, 1 a.m., 1:30 a.m. They have different lectures and they have one-on-one sessions. You are associated with the students from the US, and you sit with them, you brainstorm. And I believe I also did a project which I will show you guys. That should be there in my Google Drive. So I will just show you guys what project I did, and I got to work with two of the students. I got to see two of the students from the US. I interacted with them, networked with them. It was a wonderful experience. So you can connect with them over LinkedIn, and I think it was something called Brailleware. And if I'm not wrong, it will also be there in YouTube, because we had to upload that video in the YouTube. So I think it should be there. It's like so. It's like very old, so I think it will be very difficult for me to find it out. So I will just see. I don't think I see it right now, but let's just search in YouTube. Heal summer internship, not Heal, sorry, Case Western. I think the video should be there in their portal, if I am correct. And trust me, guys, it's not that tough to get into these universities for your masters. It's just that your resume should have a lot of content if you want to do that. So let's just go to the playlist and let's go sort. I think we cannot sort it. Yeah, I think this is the one. So my project should be there somewhere here.
So I'll say hello to everyone. My name is Michael Goldberg. I'm our executive director for the VL Institute for Entrepreneurship. I'm
No, not this one. So
Thank you
basically,
very much.
yeah, like
Welcome, everyone. It's a pleasure to be here today. As Dr. Schaefer said, you can call me Bob Kirsch. I'm the chair of biomedical engineering at Case.
okay. Anyways, it's somewhere there in YouTube. You guys can maybe eventually find it out later. So coming back to LinkedIn, you guys can update all these things. And then I joined internship at ICAT. So all till ICAT, all my experience I gained over the time I spent in college, over the time I spent in doing these internships were completely healthcare based. So it was relevant experience. But then I joined Scalar, which is more like an edtech firm for software developers. So the reason why I have put tech savvy here is because now it will make sense. Now it will make sense why in my cover photo it says that I'm a biomedical engineer, because I did biomedical engineering. I am doing sales and business development. So I started my job opportunity doing business development in sales. So that's my core forte, or that's my core skill. So it says that I'm a sales and a business development enthusiast. And why I'm in tech savvy is because when I joined Scalar, I learned everything about software development. I did a lot of learnings. I helped a lot of people to figure out their career and things like that. So I was very much involved in understanding the technologies and things like that. So that's why I have put tech savvy. Okay. And Biomed Bro, as you all know, is my part-time work which I'm doing for biomedical community, students, working professionals and things like that. So that's why I have added it here. So yeah, that's about the cover. And your profile picture should be very professional. It should not be a picture wherein you are looking at some other corner, or you are laughing, or you're doing something. It should not be an unprofessional picture that you should add. So if you look at my picture, I have removed the background and I have just added my portrait image, a laughing image, which creates like a positive impact when someone looks at this profile or the picture. Okay. So that's about profile section. So today what we will be doing is we will be covering only this much. Okay, I will just tell you how to make this much very optimized so that your profile, when someone opens, it looks very professional. Again, the heading should consist of all the things you have done and the interests. So I'm a sales development representative at ZocDoc currently. I am the founder of Biomed Bro, which is basically my part-time firm which I am doing. I am a biomedical engineer by profession. I am a career strategist. Why? Because I was helping software developers to excel in their career. So I was working like a career counselor. So career strategist is basically a synonym for career counselor, or a better word for career counselor. Okay. I'm a productivity coach. If you guys don't know what productivity coach is basically I help individuals to figure out how they can be very efficient throughout their day, how they can do a lot of things in 24 hours that they have, but still not feel tired, being more productive throughout your day. So based on the individual's lifestyle and based on the individual's likes and dislikes, I create a personalized routine for them. So if at all you want a routine like that, please feel free to comment or drop a message in the chat and we'll connect back later and I'll help you guys with the same. I'm a biomedical innovator. During my period in college, during my time I spent in college and during my internships, I always brainstormed a lot of things. I always did a lot of things to make sure that I'm innovating something new in the biomedical domains. That's why I have added biomedical innovator. I am a startup enthusiast. In my college days, I started 3 ventures, which drastically and pathetically it failed, but I am very proud of the learnings which I have gained over the period of 3 years, wherein I was working in different startups and working on different ideas that I had. And tech industry observer, it is basically meaning that I am very intact and in touch with the news and the technologies and the things that are coming in the software domain. So I've put like I'm a tech industry observer, and I'm a lifelong learner. So I believe in learning. I believe in learning from others and sharing my knowledge to others. So throughout my life, I will be a learner. So that's why I've put lifelong learner. So if an HR or if a hiring person is going through my profile, by reading this, he can understand what kind of skills I have or what kind of person I am as an individual. And then basically when you start working, developing your profile on LinkedIn, the LinkedIn algorithm itself will give you some hashtags. So if you see my hashtag, it's completely revolving around medical, biomedical, healthcare, medical device, and biomedical engineering. So because I tend to post a lot of things about these things and pretty much things like that. Okay, we have 1 minute. I've covered this much. I think around 4 or 5 people are watching right now. If you have any doubts, feel free to drop in your queries. If you have understood, you can just put that or give a thumbs up or a like or something like that. Yeah. So that's about LinkedIn. I think today it's enough for today to learn something different from angiography, right? So if at all you have any questions or doubts, please feel free to drop it. Now, meanwhile, what I will do is I will just go to the lecture that I have prepared for you all today, and we will start with the lecture. I will talk about angiography. If you guys don't know about angiography, it will be a very interactive session. You guys can learn with me. Make sure that you have a notebook and a pen, because I will be telling a lot of things which if you take note, have a notebook every day, 3 p.m. when we meet here every day. Keep a notebook and a pen with you, and in that notebook only write the things that I will be teaching you guys and I will be sharing with you all, because eventually after 1 month when you will look at that book, you will understand that yes, you have learned a lot over past 1 month, and absolutely you can add those skills in your resume, and I will tell you how to do it over the over the coming weeks. We will also see a lot of resume building activities. We will see a lot of mock interviews and things like that. Okay. So I will just take a 2 minutes of break. Meanwhile, you guys drop in any questions or any queries if you have. Okay, I will be right in front of you in few minutes. Bear with me. So there is some questions that I see on the chat. So I will answer that for sure. Revati has asked me a question and she's asking me, is it a good option to opt for MTech in biomedical engineering after UG? Oh, it's a big controversial topic, but I will like to give you my perspective on it. So see, first of all, what is undergraduate? Undergraduate is basically you are doing a degree, you are doing a course, right? Hear me very carefully. Since you have asked this question, I want to make sure that you're understanding it in a really good way. So once you are done with your undergraduate, so right now what you are doing, you are studying basic things about biomedical engineering. You are learning signal processing, digital signal processing, image processing. You are learning about a lot of medical equipments. You are learning about circuits, which includes amplifiers, transducers, and a lot of things which I hate. So yeah. So 4 years you are spending to learn the basic things in biomedical engineering. But right now also, if you ask me, I don't know in detail what biomedical engineering is like. In detail, I don't know how everything works in the industry currently, right? So you tell me, now think it hypothetically that, okay, you did your undergraduate and immediately you are planning to pursue your master's, right? Now, one thing which I will tell you is, what is master's like? Doing master's in biomedical engineering is basically specializing one specific topic, right? It's a 2 year program. First year, whatever you learned in 4 years of college, in the first year of masters, you will learn in detail, right? You will go in depth about these topics. The first year or the 2 semesters will go like that. After first year, you will have to take a specialization, right? Now, specialization. Now, let's say if you're doing masters in biomedical sciences in neural engineering. So 1 year, you will understand and learn the basic things in detail, which you have already studied in undergraduate. And when it comes to last 1 year, the second year of college, that's when you specialize. Oh my God, I can't say it. That's when you specialize. Okay. My tongue is twisting, so I'm sorry for that. So when you specialize, you have to make sure and you have to be very sure that you like that topic. So what I tell is, without working anywhere or without having any industry experience, without understanding how the next 10 years will be like for biomedical engineering, you cannot just randomly take a specialization. What will happen? Let's take two scenarios. Now I am someone who want to do masters, right? But ultimately I finish my undergraduate, I immediately go for masters. First year, I'm not facing any difficulty because everything what I've studied in 4 years of college, I'm studying that in detail. But after first year, when it comes to taking a specialization, what I will do, I will feel that, okay, neural engineering sounds good. It's an interesting topic, right? Neural engineering is good enough. And I will take that. But I will not realize the fact that once I take the specialization, if I don't like it, I will have to study it because I will have to get my master's degree. I cannot fail my semester. So I will, even if I don't like it, I will study it and I will get a specialization in that. So in the end, what will happen? I will have a master's degree with specialization in neural engineering, which I hate a lot. And then eventually, all the job opportunities which I will get in my entire life will be based or specialized on neural engineering. But because I don't like it, the job I am going to do is eventually I'm going to hate that job as well, right? So you have to make sure that you know what you have to do. So I know that I'm very good at sales. Now I don't have to do masters. Obviously, I don't have to do it in biomedical engineering, but yes, I can always do it in masters in innovation and entrepreneurship, so that I learn a lot of skills about marketing. I learn a lot of things about sales and development. I learn a lot of things about creative thinking, design thinking, developing a product. So it's a very interesting course and I can implement it in any biomedical company where I'm looking for an opportunity, right? So according to me, you shouldn't do biomedical engineering masters immediately after your undergraduate. That's just my perspective. And apart from that, various factors are there that you just don't want to burden your parents and the money that they're investing in you to do your masters. Why don't you do it yourself? Work for 2 years, 3 years, save up some money, get 100% scholarship in the university in US and do it completely free of cost. Have those kind of dreams. Just don't. And again, other thing is, don't just go for masters because you're getting an opportunity to go outside India, right? Do it from India. Really good colleges are there, but you have to clear GATE for that. Prepare for GATE. Instead of preparing for IELTS or JRE, prepare for GATE. Work for study for 1 year, give GATE exam and do your masters in an IIT, from an IIT in India, man. What can be better than that? Investment is less. You know what you are getting into. You will have the experience. You will know what kind of specialization you want to take. So a lot of benefits are there. But at the same time, that's completely my perspective. You want to go for masters after your UG. That's completely your choice. So I believe I have answered your question, Revati. Piyush, I'm confused between CAT and GATE. I will not go in depth on that right now, but I will tell you. CAT is basically if you want to pursue MBA, like if you want to do any marketing course, or if you want to do marketing. MBA is basically management course. You will have to write CAT. Once you write CAT, you can do it from IIMs, like Indian Institute of Management. You can get into one of those colleges and you can pursue your MBA. And what is GATE? GATE is technical. You are getting into technical biomedical engineering masters. You are getting into technical electrical engineering masters and things like that. And you will do it from IITs. So in simple words, CAT is for IIMs, Indian Institute of Managements, and GATE is for Indian Institute of Technology, IITs. Okay. I'll just stop there because we are running short on time. So I believe I've answered your question, Piyush. That's the reason I want to join job first after graduation. Absolutely. That's what I did. That's what I believe everyone should do. So yeah, we have already spent 8 minutes. So we are running behind 8 minutes. So now let's just get into my favorite topic, which is angiography. So as I said, every day from 3 to 4:35 I will be here doing live. If people are not there, I will just do my random things. You can learn from it, and at the same time, every day we will cover one biomedical topic or concept which will help you or which will make you more skilled enough in the industry. Okay, so starting off, study with me. Angiography. It's your Biomed bro going to teach you. So this is the first time I'm going to teach things to someone, right? So it's a lot of responsibility. If you don't understand, drop in the comment. If you don't like anything, drop in the comment. So yeah, make sure you have a notebook, you have a pen, give a heading called angiography, and then let's start off with this. So first I will tell you guys what all I am going to cover in this session, right? I will tell you guys what angiography is. Why do we need angiography? So that basically means like, why people do angiography, pretty much things like that. And after that, we will understand how does angiography work? Like what is it, what exactly it is, how exactly it works, why do people do it, how do doctors do it, what is the process, understanding that in detail. Risk and considerations. So if someone is going through an angiography, what are the risks involved, what are the considerations that we should have, and we will look on things like that. Apart from that, if you see the next, beyond the x-ray, basically comparing angiography with x-ray and understanding what how is it different, why is it different, and what complexities are there. Okay, we will be understanding that. Once that is done, we will go through the medical companies. We will go through what kind of companies are doing the best in the angiography domain. So if at all you want to pursue your career in that specific domain, what kind of companies you should aim for, which are the best players in the market, and pretty much covering things like that. Okay, so we will be covering 1 2 3 4 5 6 topics and one subtopic. So let's start off with the first one, which is what is angiography. Don't look at the text on the screen, right? So if at all you guys know what angiography is, comment, just put it on the live chat so that I can know, okay, you guys know what angiography is. If you guys don't know, then I am here to explain it to you. Let's understand it like a 10-year-old first. Angiography is like a superhero's X-ray vision for blood vessels. So there are a lot of superheroes with different superpowers, right? So imagine it like a superhero who can see through everything, who has a super X-ray vision, right? But this superhero uses it only to see blood vessels inside the body. Okay, so there is a superhero who has a X-ray vision to see blood vessels inside the body. Okay, now what eventually it does is basically it helps doctors to see how the blood is traveling through your body. Okay, and it is traveling through the very important one, which is called arteries, right? So there is a superhero, he has an X-ray vision, he can see blood vessels, and this superhero basically helps the doctors to understand how the blood is traveling through the body, specifically arteries. Okay, so I hope that is kind of clear to you guys. Now imagine, what are arteries? Now imagine arteries like a giant tube carrying a lot of food and air through your body. It's like an esophagus. Okay, so in your esophagus, what is happening? The food and the water and the air that you take, everything is going through the foot pipe and the wind pipe, and it is traveling through the body. Now again, arteries are the same thing. It is like the long giant tubes, but instead of food and instead of water, the blood passes through it. Okay, so what happens is, now what will happen, you are eating a lot of food, you cannot swallow it, and it gets stuck here and you get choked, right? So it happens basically because the foot pipe gets stuck and you feel very uneasy, and then you drink a lot of water to make sure that it is going down, and then you feel better, then you feel like a little bit calm and composed after the food passes through your body or through the esophagus, right? But imagine when it comes to arteries, the blood is flowing through the arteries. Suddenly if a blockage is there, the blood will not flow. If the blood will not flow, it will not reach the heart, it will not reach your brain, and eventually you may faint and eventually you may die, right? So that's what I've written here, like imagine your arteries like a giant tubes carrying food and air around your body, but sometimes they get clogged up due to the dirt, drain, and it makes it very difficult for you to swallow the food, right? The same way, when the doctor will take help of this superhero, when there is a blockage in the artery, when there is a blockage and the blood is not able to pass through, right? So angiography is a superhero which has a superpower. What is the superpower? The superpower is to see through everything, and basically they can see the blood vessels, right? And what does the superhero do? The superhero basically helps you to figure out where the blockage is, right? So he's just like a plumber who uses a camera to see what's wrong with the pipe, right? So if at all in your home, If you have a long water pipe and if something gets stuck, you put some stick or you put something and you try to see what is there, what is because of what the water is not coming through. The same way, when it comes to your body, the arteries may get blocked, right? And when they are blocked, how will you see? Like, let's say if I am having a blockage in my heart, a random person cannot see it. A random doctor cannot see me and tell that he's having issues in his heart and the blood is not flowing, there is a blockage. How do they figure this out? And that's exactly where angiography comes into help. Summarizing this slide again, there is a superhero. The superhero's name is angiography. He has a superpower. What is the superpower? X-ray vision for blood vessels. Okay. Now, when this superhero will help? When the doctor needs help to figure out where the blockage is in the body. Right? 3 important things. Make note of these 3 important things. And now you know what is angiography. Right? If you understood, drop in a like or something. If you have any doubts in the specific slide, put it in the chat. I will answer it across when we move forward. Okay. There is a 15 seconds of delay. So once you put a message, I will get it in 15 seconds. So I'm okay with that. So we just understood what is angiography, but we have to define it as well. Tomorrow, if you are going to an interview, you have to answer what is an angiography, right? So basically it's, as I said, it's imagine like an X-ray that can not only see your bones, but also the blood vessels or the blood flowing through your body. That's the magic of angiography. But basically it's a medical technique which uses X-rays and a special dye to reveal the inner workings of your vascular system, particularly focusing on arteries. So what is an angiography, you know, but if you have to define it, it is basically a medical imaging technique which uses X-rays with the use of a special dye to reveal the entire workings of your vascular system, particularly arteries. Okay. So that's like a definition you can give when if at all you are being asked the same question in an interview or even in your exams. So we understood what is angiography and we learned how to define what is angiography in professional terms. So the previous one, the way we discussed it is more like a casual way of understanding it, but this is more like a professional way of defining it. Okay. Coming to the next topic. Okay, before that, I just wanted to show you how it looks, how an angiography scan or how exactly it helps. So when the doctor uses this dye and when the doctor uses angiography, he will get a lot of pictures like this. Okay. I hope you can see the screen. The picture may not be very visible because it's the small ones. So there will be different pictures that the doctor will be taking. And when they analyze the picture, can you guys just figure out where the block is there in this artery or it is basically the heart, right? So this is like the heart, like this is how the heart looks. If you imagine it, the cartoon, the diagram of the heart, this is the heart. So can you find out where the blockage is? Now, being a biomedical engineer, it is very important for you to see images like this and understand where the blockage is and things like that. So if you see carefully, can you see the pointer? Can you see here? There is a small blockage right there. See here if you see. There is a small blockage here in the artery. So that's the blockage. So the doctor, when they use angiography, they figure out, okay, the blockage is there. But there is one more question, how to remove this blockage. We'll cover that as well in this lecture. Okay. Coming to the next slide. So why do we need angiography? Right? Why exactly is it needed? You know, like it is needed because there will be a blockage in the artery and you have to get it fixed. But when do you realize that you have a blockage? So let's understand why do we need angiography in the first place. So again, taking an example, I believe learning with an example and understanding the concept is the best way to remember things. So just like a traffic jam, what happens when there is a traffic jam and there is a speed car coming in and bashes one car and it is like a domino effect. It creates like a huge accident on the road. The same happens here. So once your arteries are clogged, the blood flow will stop. The blood flow will stop. There's a lot of pressure which is coming on to that specific point, and that's when your heart starts aching, right? So that's usually how heart attack or stroke happens. What happens before, like what happens in a heart attack is basically, you feel a lot of pain on your chest. And why that pain? That pain is because the artery is blocked. So if you see the previous image right here, see, this is the artery. So the artery is blocked. and there's a lot of pressure here, and there's no pressure here because this blood will flow through, and there is a very little blood which can come through the blockage and can pass on. But there is a huge pressure right here in this point, and that eventually causes you the chest pain, and you feel like you're having a heart attack, and that's exactly when you rush into the hospital and you meet the doctor, right? So that's exactly where angiography comes in. It's like a helicopter, so there is a helicopter flying on the road, and as soon as this accident happens, the emergency contact. What are the risks associated with angiography? I will cover that in the coming slides. I will tell you what all risks are there. So thank you for that question. I'll address it in the coming slides. So it's like, as I was telling, so angiography is like when a road accident will happen in US, and if you see in US and all that, the helicopter will come immediately, assess the entire situation, and then again will call the emergency people, or will call the traffic people to sort out the things, and pretty much things like that. And that's exactly what angiography does. Okay, so it is used to find the blockage. That is the first point which we discussed. Think of it like spotting a broken down truck blocking the lane. So angiography lets the doctor see exactly where the clog is in your artery. Again, the same thing which we covered in the previous slide. So why do we need angiography? To find out the blockage in the heart. Okay, where blockage in the heart, to specifically arteries. And second, see the overall health of your blood vessels. So angiography gives doctor a good picture of how well your blood vessel or the blood is flowing through in your body in general. So two reasons why we do angiography. The first one is to find or figure out where the blockage is, and the second one to understand the overall health of your blood vessel. So two reasons majorly why angiography is done. So what all we covered so far: what is angiography, how to define angiography. We looked at real-time pictures on how the angiography image looks like, and then we also studied right now why do we need angiography. Okay, coming to the next slide. How does it work? So I have made it in a very systematic way, like a story. Like it will have super characters, and by the end of it you will understand how angiography is done. Okay, so there are 4 characters here. The first character is the detective catheter. Okay, so the character's name is, he's a detective and his name is catheter. So the first character is the detective catheter. The second character is the glowing liquid. So the glowing liquid is a secret ingredient that these characters would be using. The third one is the X-ray reveal. As I said, it is the superpower that the superhero has. Okay, and the fourth one is decoding the clues. It is like a puzzle that they will be solving in the end. Okay, so 4 characters: the detective catheter, the magic or the glowing liquid, the X-ray reveal, and decoding the clues. Okay, let's see how the first character, or what the first character does. So this guy is the detective catheter. Okay, so what happens, the first step is you did angiography. Okay, you understand where the blockage is. Then what happens? So the doctor would send in a super thin flexible tube called catheter. Okay, so if you see this picture, this is not the catheter. This thing going inside is the catheter. Okay, so it is like a tiny spice sneaking through a vent. This is the vent. Okay, so what happens is, first the vent will go. So vent will be like this. Like the vent will go through your arteries, and then the stent will go inside that. Like the catheter will go inside that. Okay, so the detective catheter, as the name says, is like a spy, a tiny sneaking spy, which will go inside through a vent, and he is very thin and he is very flexible and he's like a tube. Okay, that's called catheter. So what is a catheter? Catheter is a tiny, super thin, super flexible tube which goes through a vent inside the body, or inside the chest, or inside the artery. Okay, now this agent travels all the way up to the main highway, which is aorta in your chest. So first of all, the vent, right? The vent will go through in. It is just it will be till halfway only. Okay, so the vent will go. Inside the vent, the superhero will enter. The superhero catheter, the super agent, the detective agent will enter through the catheter, through the vent, and it will reach till the aorta, which is your chest. It will reach till there. It's very super thin and it's very super flexible, so it's easy to move. It's easy to travel through everything and reach the aorta in your chest. Okay, so the first step is using a vent, using a catheter, sending the catheter inside inside the heart, and it should reach till the chest. What is a catheter? Catheter is like a tube which is super thin, super flexible, and it can travel through the twists and turns that he or she may face, and that eventually ends up in your chest, specifically in aorta. That's like the first step. The second step, the glowing liquid. Now see, to see where the blood is flowing, now obviously if you take a normal x-ray, so the image that you saw right here, are there any specific post-procedure instructions or precautions that patients should follow? Yes, it is there. I will let you know what it is. So this image that you see, right, the black color, this is visible because of the glowing liquid that the doctor is using. Okay, so the first step is to insert the vent. The second step is to put the catheter. Make sure the catheter reaches till the aorta if the block is there. Wherever the block is there, the catheter should go till there. And then the doctor will inject a glowing liquid. So it is basically the contrast dye. Now what is the special liquid? The special liquid is the contrast dye. Now this dye helps us to see, or helps the doctors to see where or how the blood is flowing. Okay, it's like hidden clues for the doctors. So if you read it once, you will understand it. To see where the blood is flowing and where it's not. So basically to figure out where the block is. Wherever the block is, the blood will not flow. So this contrast dye is injected in to see where the blood is flowing and where the blood is not flowing. And once the dye is visible on the image, you can understand where exactly the blockage is there. And how exactly they inject it? This is the way that they inject it. Okay, so they'll have different tools, you could say, and they will inject the dye. So this is the dye. It will be in an injection, and they will insert the dye in, and the dye will go through all around your body. It will go through your chest, the arteries, and the doctors will be able to figure out where the blood is flowing and where the blood is not flowing. So this magic juice shines brightly on x-rays. So that's when, like, when you take an x-ray, it is visible. The veins and the arteries are very much visible. The blood, how is it flowing? It's very visible. And the same principle is used when you talk about CT scan and MRIs. You inject a dye, and there is a lot of magnetic resonating junction points, and it basically takes an image, and because of the dye, you see the MRI scan. So all these scans that happen in the medical industry usually takes the principle of dye, like the injector dye inside the body, not the x-rays. X-rays is just to see the bones, but to see or to scan the other things, organs, or brain or anything of that sort, they inject a dye, and because of the dye, you can see everything that is inside the body. So first, detective catheter, which goes inside the heart. Second, the glowing liquid, which is like a secret ingredient to see how the blood is flowing. So 2 steps. I hope it's clear. Step 3 will be the X-ray reveal. So what happens after that? So once this dye is injected in, it will travel through your artery, and then there is an X-ray which is taken by a machine. Okay, so that there's a machine which will take a picture. It's like a high-tech camera capturing the glowing blood flow. So see, this is the normal heart, right? This is the normal heart. This is how it looks like. It has a lot of arteries, right? And there will be, so once you inject the dye will be absorbed by the blood, and because of that, you will take an image, and this is the image. This is a real-time image that the doctor would have taken, and this is how it looks. Can you see how many minute pores, vessels, and how many things are there in the heart, right? I the first time I saw this picture, I myself was amazed. Like, our heart is very little. It basically it basically pumps the blood through the entire body, and can you see how many pores, how many tubes, how many minute capillary like structures are there? So once you inject the dye, can you see what this is? Can you understand what this is? This, if I'm getting it right, this may be the vent through which the catheter will go in, or the dye will go in. So you put the dye, it will flow all across your heart, and this is how you get the image. Okay, so the dye will zip through your artery, and then there is an X-ray picture is taken. Once the X-ray picture is taken, you can see the inner highways or the inner arteries, everything, whatever is there, you can see it and you can figure out where the artery is clogged or where the blockage is there. So if you see this picture, very difficult for me to say where the blockage is, but yeah, so that's how the X-ray reveal happens. I hope it's clear, very easy. Detective catheter goes inside the heart with a tube-like structure called vent, right? He can reach till aorta of the heart. Second step, the doctor will inject a dye, which is called the contrast dye, which is like a super magical liquid which will reveal everything that is there inside the heart. But to see that, doctor needs to take X-ray picture. Now this X-ray picture is taken through the high-tech cameras, and from these high-tech cameras the doctor will get a picture, and once the doctor gets this picture, he will understand where the blockage is and things like that. Now what is the step 4? Step 4 is decoding the clues, as I said. Just like a detective analyzing the fingerprints, the doctor examines the scan images. So they can see where the blood is flowing smoothly, where it has slowed down a little bit, and if there is a specific bump or leak happening in the heart, or pretty much things like that. So with this information, the doctor can diagnose any problem with your blood vessels and decide how to help them run smoothly again. So like what happens once they get the scan, they will go through the scan in detail. Now the doctors are taught or trained in such a way that looking at the image, they figure out where the blood is flowing little slow, where the blood is flowing normally, where the blockage is there, where the leaks are happening and things like that. Now once they diagnose all these things, they will create a plan of action, how to make it flow better, or how to remove that blockage, or how to make the blood flow at a faster pace in the specific junction and things like that. So ultimately doctors are the decoders. Like there are ethical hackers who decode a lot of encrypted passwords, the same way doctors come into picture when you talk about human body, right? So they have the X-ray image, the doctors decode the image and they make a plan of action, right? So we have covered 4 steps: detective catheter, glowing liquid, and the third one was X-ray reveal, and the fourth one was decoding the clues. What after this? How does angiography work? After this is when angiography happens, right? So the doctor realizes that this yellow thing that you see, now this can be fat. So that's why we talk a lot about good cholesterol, bad cholesterol. So if this yellow thing that you see, it is basically the bad cholesterol that develops in the heart when you eat a lot of junk food, oil and things like that. So because of that, the arteries will bulk up because of the fat. So let's say if the blood is, if you see this, consider this as a normal artery. Are there any potential risk or side effect associated with glowing liquid? Yes, there are side effects. You are always asked to drink a lot of water because sometimes it may cause rashes, sometimes it may cause internal burning sensation, and ultimately this dye goes through your urine, right? So the kidney has to do a lot of work. That's why we tell you drink a lot of water and things like that. So that is basically the risk or the side effect associated with the glowing liquid. It is not the glowing liquid, it is basically called the dye, contrast dye. So I will just put it in the chat so that you don't forget. Glowing liquid equals to, so I'm telling it because tomorrow if you talk to someone, you don't tell doctor uses glowing liquid, you tell doctor uses contrast dye. Okay, so consider this situation. Now if you see here, I'll rather explain with the picture. This is like a normal artery. Okay, now this normal artery, when you eat a lot of junk food or the bad cholesterol comes in, it takes a bump like this. Can you see? This is the bump that you would be seeing in the picture. You see here, right here, this is the bump. Now what happens is, this is the catheter that goes in. Okay, so the catheter goes in and then there is a vent. So this is basically the vent. It's like a cage like structure that you see. So the catheter goes in and it pulls the vent, it expands the vent. So because of the vent, it is like compressed, the fat is compressed and it stays like this. Okay, and the blood starts flowing back to normal again. Understood? Any doubts? Little confusing, I'll explain it again. Normal artery, because of some XYZ reasons, fat buildup is there. Because of the fat buildup, the blood is not flowing properly or smoothly. Which machine used for this procedure? I'll come to that. So basically you have heard about angioplasty, right? Angioplasty, like your relatives would have told, that uncle got angioplasty, there was open heart surgery which happened. So usually angioplasty refers to putting a stent in the artery to make sure that the blood is flowing normally. So there's no machine as such which is used. Usually it's the stent which is used. Okay. So this is the stent, the cage-like structure that you see, that is the stent, which is then placed in the spot where that blockage is there to make sure the blood is flowing normally. That's how the entire angioplasty or the angiography works. So it's like a very systematic process. Detective catheter, vent. So the detective catheter will go inside the heart through the vent, and then using the magical glowing liquid, which is the contrast dye, it will reveal everything that is there in the heart. Then we will take a picture so that the doctors can decode what is happening. Once the doctor understand the blockage is there, then what they'll do, they will put in a stent, like they will basically put in the stent in the specific place where exactly the blockage is, and the blood starts flowing normally. Okay, very simple process, easy to understand. Bharat has commented cath lab. Yeah, cath lab, exactly. That is like, again, you have heard about cath lab procedures and things like that. So material used for stent and catheter. I myself have to Google it. I am not sure, but we'll let's before moving to the next topic, let's just see, right? I don't know in detail because I am also learning with you guys. I'm a sales guy, but like I'm teaching you guys right now. Material used for stent. So that's exactly where biomaterials come into picture. So it's like a metal mesh, fabric, silicone, or like combination of materials. So I will just copy this and I will put it in the chat for Piyush. So yeah, so you guys can again understand stents can be made from metal mesh, fabric, silicone, or a combination of all these materials. And let's also see how the stent looks like. Since you put in the picture, this is how the stent looks like. Okay, it looks very big, but you imagine, it's like very small. Your arteries are very small, so these are very minute, and it's a very, very, very thin kind of structures which goes inside your body. Okay, and this thing that you see, this colorful thing, that is basically the catheter, and this colorless tube on top of that is the vent, and basically this is the stent. I hope that makes sense. Okay, coming back to our topic. Before that, I see a couple of messages right there in the chat. Asif says hi. So basically, Asif is one of my colleague. He is a doctor. So yeah, just wanted to mention that. So he will be able to answer few of the queries because he's a doctor. There is a question from Aishu which says, how do doctors use the glowing liquid to see the blood vessel better during the procedure? During the procedure, they don't see the blood vessels. That's what I was telling you guys. See, I'll again come back to the picture. If you look at this picture, this is how they inject the dye. Once they inject the dye, I'll come to that question. Once they inject the dye will be there for good amount of hours, right? And they'll take an X-ray image. Once they take an X-ray image, they'll analyze the image and they will figure out the spot where the blockage is there. And based on that spots or based on that location, the doctor will put in the stent and they will do the entire procedure. So they first figure out where exactly most durable is left mammary artery, less chance of getting graft rejection. Thanks a lot for that, Asif. So once they put the dye, once they take the image, they figure out where the blockage is. Once they understand where the blockage is, then they start the entire procedure and eventually they end up putting up the stent there. Okay. And that is one question. I hope I answered that question. So during the procedure, there are no more X-rays being taken, but I feel after the procedure, they do take a scan to check whether everything is fine, if I'm correct. What if stent will collapse? I believe again there is another attack which would happen. So that's why like people who have already done angioplasty, again if they're having a heart attack, again there is a blockage that is very like serious, like that's very dangerous. Again if that happens, again you have to do the angioplasty, and it basically means your heart is getting affected and things like that. So it is not good to have another heart attack or things like that. Again, what if stent will collapse? If the stent collapses, again there will be a blockage, and again there will be there will be an attack which would happen as outcome of the collapsed stent. Okay, but I feel it is a rarely that happens. I don't know, Asif can give a better answer to that. Most durable is the left mammary artery, where there's less chance of graft rejection. So I think that is what he means, that left mammary artery is the place where most of the blockages are visible, and once you place the stent there, the graft rejection is basically the stent that you put, it is grafted into the artery, so the graft rejection is very less in the left mammary artery. Okay, I hope I got it. Coming back, following up. So see, this is the blockage that the doctors would see once they figure out this spot, the blue spot that you see on the screen. Can you see? There's a blockage here. So once that blockage the doctors figure out through the image, they will do this procedure, place a stent, and the person or the blood will be flowing back in a normal rate. Few things to remember. Angiography is not like a normal X-ray. In this, there is a special detective tool used, which is the contrast dye, to make sure that the blood vessels are visible. So angiography is also like an X-ray, but it is different from an X-ray because we are using a contrast dye to take images. Second question, the contrast dye is safe and usually leaves your body through urine. But again, the external factors come into picture. If someone is suffering from diabetes, glucose and things like that. I think there are 3 types of stent. I don't know the names, but you are showing is modern one. Okay, let's just see that. Different types of stent. So there are 2 main types, and I think the third one is the combination of both. So bare metal, so there is the metal one, there is drug eluting stent. Okay, so a drug eluting stent is basically the stent which is coated with medication that eventually reduces the risk of arteries becoming blocked again. That's something new I also learned. I'll put it in the chat so that you guys can also go through it. Dacron. Okay, what's Dacron? Can you just tell what's Dacron? I don't know. So yeah, there are 3 types of stent. One will be metal one, one will be drug eluting stent, and the third one will be silicone stent or the combination of metal and silicone. Asif said Dacron graft. I think this is the one. Polyester graft. Okay, I believe that polyester one is the combination of silicone and things like that. Good point, Piyush. I believe now you know what are the 3 different kinds of stent. So coming back to the screen, and we were thinking about the points to remember. So the contrast dye is usually safe. It goes through your body through urine. That's why you're told to drink a lot of water after all these kind of surgeries and things like that. Angiography is different from X-ray because we are using a contrast dye. And now the last point is the whole process helps doctors keep your blood highways flowing so you can stay healthy and keep exploring. So basically the doctors do entire procedure to make sure that your heart is working normally without any pressure points or without any complications. And these are the 3 points that you should remember. Okay. Risk and considerations, coming back to the question from, it was a question from Aishu if I'm correct. What are the risks associated with angiography? So these are basically the risks. Bruising or bleeding. So basically from the point where they put the stent and things like that, sometimes there will be bruising or scratches that can come in. Sometimes the bleeding can happen. So as soon as the bleeding happens, as soon as the bruising or something like that happens, you have to make sure that you're contacting or reaching out to your doctor or the surgeon. Second, ouches and discomfort. Obviously they give you anesthetics to do this entire procedure. Post the anesthetic effect is gone, you may feel a lot of discomfort, you may feel a lot of pain and things like that. Red alert is from wherever the surgery is being performed. If you see rashes, if you see a lot of red rashes, or if you see any kind of redness, or if you see itching or any kind of those things, you need to make sure that you're reaching out to the doctor immediately, because that can be the signs of infection. And the 4th point is unexpected allergy. there are chances that you may get allergy because of the dye that got injected into your body and things like that. So before they inject the dye, they make sure they ask if you have any kind of allergies and things like that. So these are basically the risks and considerations that you should take care. Bruising or bleeding, redness or rashiness, ouches and discomfort, and ultimately the unexpected allergy can come in. So that's why, like, after these kind of procedures are done, they keep you in observation for 4 days, 5 days, a week, 2 week, depending on the patient's situation, to make sure that all these risks are reduced to negligible. And once everything is made sure that is up to the mark, that's when they discharge you from the hospital. Okay. Beyond x-ray. Okay, fine. Coming back to the point again. If angiography reveals a blockage, your doctor may recommend angioplasty. That's what I said right now. If at all angiography is done, the block is found, you have to do angioplasty, which is like a minimal invasive procedure. Now, one thing, the doctor will not perform it like a open heart surgery. It's a minimal invasive surgery, which means a small part of your part would be cut, and the stent will be put inside, or the catheter will be put inside through one small opening or one small point. So that's why it's called a minimal invasive procedure. Okay. And basically that uses a balloon to open up the narrowed artery. So first of all, this balloon will open up the narrow artery. Once it is opened up, the stent is expanded and it is grafted into the artery, and then the balloon is deflated and the stent is taken out and your heart starts working normally. Sometimes a stent or a small expandable tube is placed to keep the artery open and prevent future blockages. Okay, so someone asked, what if it collapses? If that option is considered, it can collapse or things like that, in that case they will keep an expandable tube to keep the stent in place, and the stent is grafted into the artery. Which artery? Left mammary artery is the best because it has less chance of graft rejection. So thanks to Asif for that. So it's beyond x-ray. So x-ray is just taking the x-ray, figuring out where the bone is broken or damaged or things like that. But in this case, you have to analyze, take the picture, and then do a minimal invasive procedure to make sure that the complications are reduced. Okay. Coming back, what are the best angiography device companies? This is what is useful for us, and this is what is not useful for the doctors, because being biomedical engineers, these are the companies where we can look for opportunities if you want to enter this market. So if you are a biomedical engineering student and you want to work as a sales guy in any of the companies which is developing a lot of catheters, vents, or things like that, stents, things like that. So these are the top 5 companies. Angiodynamics Incorporation, that is the first company. Now this is not just random companies. According to the last financial year, the most revenue was generated by Angiodynamics Incorporation last year. Second one is Canon Medical Systems Corporation. You guys would have heard Canon as a camera brand, correct? We have a lot of cameras by Canon and things like that. But did you also realize that Canon has a lot of imaging tools? So the X-ray, like to take the X-ray of the heart while you do this process, Canon lenses are used, Canon cameras are used, Canon machines are used. At the same time, GE Healthcare again is so as biomedical engineer, we usually think of GE Healthcare and Siemens, but there are other 3 companies which maybe you have never heard of. Koning Lichke is again Philips. So basically that's Philips full name. So I will say Philips Healthcare. So GE Healthcare, Siemens, and Philips Healthcare are the bottom 3 companies, but the top 2 companies are Angiodynamics Incorporation and Canon Medical Systems Corporation. Let's just see the products as well so that you get an idea as to what kind of products you can expect. Canon Medical Systems Corporation, you go to the website. Now you see. We will continue browsing because it's in the Asia. Okay. See, if you see their product, it completely showcases that. If you see this image, you can understand. It is basically talking about the X-ray. So they have products to take scan of brain. They have products to take scan of pregnant women. They have scans to make sure understand what is there in the heart. They have for the pelvic region, and also they have for the lungs. Okay, so the main, as the name suggests, they are into lenses, they are into scanning. These are the different products that they have. Okay, now let's just see what kind of products they have in angiography. Can you see there is a different section altogether for angiography? Click on that. This is the entire machine that they have for angiography. Okay, you can watch the video. Let's just see it.
Life is fragile. Every day, patients require treatment.
Let's watch it in YouTube. So after this, I will...
Treatment for health challenges. When imaging limitations lengthen procedures, cath lab staff risk exposure to radiation. Introducing Alphanix Evolve Edition. With intelligent Alpha Evolve technology, delivering up to twice the contrast to noise ratio compared to conventional fluoroscopy in real time. So patients and medical staff enjoy greater safety and peace of mind. Powered by Canon's Altivity suite of deep learning technology, Alphanix Evolve delivers proven AI technology to interventional cardiology, improving image quality,
So basically, if you guys see, they are talking about using deep learning and AI in the specific technology. So as biomedical engineering students, we don't know how to implement AI, how to implement machine learning. So these kind of companies are actually implementing it in their products, and we are not aware about it. So that's like, if you see this process, they will tell exactly how it's done.
and enabling the potential for improved workflow and reduced dose.
I will stop right there. It's a 17-minute video. I will put the link in the chat. You go ahead and watch that video once the session is done. So now I'm coming back to important point. Now let's say if you are a student and one second. Okay. So now let's say if you are a student, okay, you are a biomedical engineering student, and now you feel that, okay, angiography is something wherein I want to get my job in, or I want to get placed in Canon. What you should do? I'm telling that if you are in first year, second year, third year, fourth year, irrespective of which year you are studying in right now, what you need to do is they have one product called Alphanix Evolve Edition. Okay, learn more about this. You will get the entire manual. You will get all the details as to how it is working, what kind of technology it is using. Learn everything, intelligent solutions. So it will tell you why is it different from other technological products that are there in the industry. Can you see? Go through all these things, make a report. Make a report, handwritten report I'm telling about. Either it can be handwritten or it can be in a Google document, whatever is convenient for you. Make that specific document. Once you learn all these things, you can always say that you are trained on Alphanix Evolve Edition. Why you are telling you are trained on? Because as a biomedical engineer, you should just know how these kind of things are working, right? So once you study all these things, in your resume, put a specific section called medical equipments and put the name of the equipment, Alphanix Evolve Edition by Canon Medical Systems, Canon Imaging Medical Systems. And now that's how your resume will stand out. Tell me, like, how many of your friends will have those kind of points in their resume? I feel like none of them does things like this. And these kind of things is what will make you stand out, right? So this is about Canon Medical Systems. The other company would be Angiodynamics. Let's see that also. Okay, Angiodynamics is again the top companies. I will directly go to their products. Okay, so in the products, if you see vascular interventions, so vascular interventions is basically the angiography, stent, catheter, it will include all of those things. So they have different products here. They have syntax support catheter, they have alpha vac, and they have different supplies. They have infusion catheters, they have drainage catheter, they have infusion system, which is like speedlizer infusion system, angiographic catheter. So let's say we just want to see this. Let's see soft view angiographic catheter. This is a product, the benefits of this product, product literature. So how you have to study is every product will have a PDF. So if you open that PDF, it will tell everything about the product. Okay, it will be like a book. So it will talk about everything, how they have developed this product, what were the complications, how they have made sure that, you know, it is different from the older versions, and pretty much things like that. So see, if you see, it will compare and tell you how efficient the product is, and that's how you learn about a product. Okay, once you do this, maybe download this PDF, go to your LinkedIn, post this PDF, and on the article side you write whatever you have learned and why you think this product is different from other companies' products and what makes them stand out. That's how you get traction. That's how your LinkedIn profile gets more visibility. Okay, and other three companies, I am not going towards that, because Siemens, GE Healthcare, Philips, these are the players in the market, and just go to the website. Do the same thing for other companies also. If you want to get into Siemens, make sure your resume has a lot of specialization on medical equipments from Siemens, and that will help you to get traction from the company people or the people who are working in Siemens. Okay, and that's all. I believe the session was helpful, right? We spent 1 hour studying angiography. So now questions, if at all you have any questions, if you have anything to ask directly to me, I will be really grateful. One thing which I would be really grateful for you all is you can just take a screenshot if you are watching this video till here. If you were there, make sure you take a picture of this, of the computer screen, go to your Instagram, tag me on your Instagram story. I have posted my username on the chat. Tag me and I will make sure that I'm reposting your stories. The ultimate reason I'm asking you all to do this is because I want to make sure that more students join in this daily sessions that we will be doing. We'll be doing it from Monday to Friday every day. 30 minutes initially we will spend learning something new. 1 hour we will be focusing on studying a biomedical concept, and last 30 minutes we will spend on figuring out what all questions you have. You can just ask it and I will be more than happy to answer them. So are there any alternative imaging techniques for angiography? Yes, there are different products. I would say there is no as such of a different product altogether, but see, this is like a product. Alphanix, the new Alphanix Evolve edition by Canon is like a tool altogether, right? So it's like a different tool that people use to do the imaging. Smoking is the most cause that leads to atherosclerosis, followed by lipid intake and old age. That makes absolute sense. So stop smoking. It's injurious to health. Thanks, Aishu, for joining in. I hope I was able to help you out. So if you can, please tag me on Instagram. Just take a screenshot of the screen, and yeah, we'll be good to go. So I'll just turn off my screen share and I'll come to the main screen, and now we can talk peacefully. I will spend 5 more minutes. If you have any questions, any queries, please feel free to drop in. Asif is telling you there's an alternative imaging technique, which is color Doppler for arteries and duplex for veins. Let's just see. You guys can just Google it. If I share screen again, the session will extend. Thanks a lot, Asif, for sharing in your information. He's a doctor, by the way. And yeah, so if at all you biomedical engineers want to connect with Asif, feel free to connect with me on the WhatsApp channel. I will make sure Asif is joining the WhatsApp community right away so that you can reach out to him as well. I will just add him to the WhatsApp group. Any other questions? Anyone else? We'll spend 2 more minutes and I will drop off. If not, then please make sure that you're tagging me on your LinkedIn stories and Instagram stories. I'm right on my phone. So yeah. How about I start a training firm to train biomedical engineering students like you? What do you guys say? Can we do it? But I don't know if people will pay for it. So you guys can tell if I teach good, I will consider that in the long run and we can start up a training venture for biomedical students completely free of cost. And yeah, we can plan that if at all people are interested. As if I am sending or adding you to the WhatsApp community so that students can reach out to you directly. I have added him on the group. So he's there. Go for it. Absolutely. Now I'll consider it. So for that, I'll have to make a lot of content. Maybe once all these lectures pile up, we have around 15-20 topics. We can launch it as an internship because right now a lot of students are struggling to get these kind of internships. So we can compile it as an internship and we can go about it. Thank you, Sijan, for this session. What's the topic for next session? Absolutely good question. I will just tell you guys what is the next topic I have for you guys before you guys leave. Thanks a lot for reminding me that. I will just tell you guys what's the next topic we have. I think it is ECG if I'm correct. Just give me a second. Yeah, so the next topic is anesthesia machine. So the next topic we will be covering tomorrow or day after tomorrow because I have to make notes for this. So the next topic we will be covering is anesthesia machine, or if you guys want, we can cover angioplasty and stents. So we can see about different type of angioplasty, different kind of stents and things like that. So you guys can tell whether you want angioplasty and stents or whether you want anesthesia machine. Whatever you guys are interested, we will do that. I think there are around 4 viewers, including me, 2 viewers. So I believe this session was helpful. I will just stay for 1 more minute. If at all any questions are there, drop it in the WhatsApp channel. If you don't know or have the link for the WhatsApp community, it's there in the description. Go ahead, join the WhatsApp group and you can directly reach out to me for any help or questions or queries that you may have. Okay. So we spent around 1.5 hours in this session today. Every day from 3 to 4:30, Monday to Friday, I will be here teaching you all and sharing my knowledge across to you all. And I'll see you tomorrow in the next. Till then, stay safe, stay home. It's your Biomed bro signing off and see you in the next. Bye-bye. Before I leave, could you please consider sharing a smile with everyone during the entire session? It would be really appreciated. When I am teaching, I can't, I get into that zone. But yes, that's a really good feedback. I really appreciate and I will make sure that I smile from tomorrow's session while I teach. Okay. So see you in my next. Till then, stay safe, keep learning, keep teaching.